Super excited to be here with you three at ViVe 2024 in Los Angeles. We'll give you each a moment to comment, but really want to focus on your virtual first care program. I know you're all very excited about it. We'll kick it off and then everyone will get a chance to dive in.
We are thrilled to be here at ViVe. We're always thrilled to be here with you, Jared. And today we are buzzing after a brilliant virtual first care session. Our impact community brought together some of the best examples of how virtual first care that's built around the patient, not the clinic, is really maturing in 2024. This is no longer sort of direct to consumer care only. This is no longer something that healthcare systems perceive might compete with them. There are reimbursement pathways. This care is being used to make sure that healthcare systems can provide care to every patient they need, especially when they are challenged by clinician shortages. This is making sure that people have access. This is making sure that people have access not just to a visit, but to a complete solution. This is meeting patients where they are with evidence-based care. And not only did we have stories about great patient experience, about great outcomes, we're hearing that there's really terrific sort of ROI associated with these things, which goes hand in hand with sort of payers being increasingly ready to reimburse for this care. It was such an exciting day, and we're so proud of every member of our virtual first care community for the case examples they could bring to the table.
Yeah, it was incredible to see over 200 people actually show up on a Sunday afternoon and say, I want to learn how I can help advance virtual first care. And it's just always so exciting to see our impact members, the leaders of the field, want to accelerate change with us, want to work with us to shape the market so that the ecosystem can fully embrace virtual first care. So it's really exciting to give these leaders a platform to talk about how they are innovating with digitally enabled care models.
And to hear that these are solutions that are full stack at this point. It is not a point solution. We had representation from folks who do go direct to consumer, but it's sophisticated. It is not just Tinder for health. It is a much more complex, sophisticated way of approaching the market, of providing health to this patient population who otherwise would have perhaps inadequate or just limited access to traditional ways of getting care. And so it was exciting to see all of them there today to provide just that breadth of content of what's going on in the virtual space. It is applying health to patient populations that are lives in health plans, as opposed to being an added cost. It is being perceived as a different thing. It is a way to expand and extend how health systems are able to care for the patients that they see, as opposed to replacing and causing leakage with the health system. So it's really interesting to see how it's evolving.
You all are such big advocates for this space, and you're very thoughtful in anything that you end up rolling out. What challenges do you still see in this space that we need to, it can be regulatory, but that we need to overcome as an industry?
It's one of those really interesting things that we still need to define all too often what we mean by virtual first care. This isn't virtual only care where we are trying to strip people back from a traditional healthcare system. It's also not bolt-on telehealth, which is exactly the same encounter and visit and care that you would have had through a face-to-face interaction, but just disintermediated through a video visit. Which is not to say that there's not value in that, but we have such a wealth of technical sort of opportunity, such a great way to connect individuals with the specialist provider that they need, regardless of place. The fact that we still need to do some education around this, I think, is one of the big challenges, because until people actually understand what the benefits are, thinking about some of the mechanisms for implementation is still 2 or 3 steps away.
And I think some of that education in particular gets held up on the reimbursement side. And it's not a particular target or entity that's holding it up, as much as conceptually, as an institution, the delivery of health is rooted in such an in-person, face-to-face model that it is very hard to make the changes necessary to be able to provide compensation that incentivizes leveraging these digital engagement techniques to improve the health of all of these patients outside of those 15-minute in-person episodic engagements with the provider. So reimbursement is still something that is an evolving conversation. How do we provide coverage for patients who are receiving health through virtual means? What is the right coding in order to provide the payment for those patients so that virtual providers have a means to actually see their businesses end up succeeding.
And what's phenomenal about our impact community is the appetite to actually want to drive that change, to want to drive billing innovation, while also recognizing that we need really tactical approaches to reimbursement today. So Impact put out a payment and coding toolkit to help these virtual first care providers get paid today, recognizing that there's still a lot that we need to do so that we can fully embrace this new model of care.
So exciting. I'm happy for all of you, and I look forward to continuing to see anything that you end up rolling out, because it's always super impactful and very beneficial to lots in the space.
Thanks very
Terrific.
much. Appreciate it.